off. So welcome everyone, thank you for coming. If you don't know who I am, Dr. Peter Blakey, former president of the Vet Association, formerly RX Vet and now GLA Farmer. So yeah, really great to have you guys here. Just a couple of housekeeping things, exits, there's a fire or whatever, that way and that way. Toilets are just around the corner if you haven't found them. So the agenda for the evening, we're very lucky to have Janine van Dam to talk to us about dentistry. You probably all know her pretty well, being a local here from Christchurch. So she's going to talk to you about some top sort of 5 dental problems in cats and dogs. We'll then, myself and Kim from GLA Farmer down the back, we will have a brief talk just on our new Pluck 10 Plus dental range and a couple of our other new products. We will have questions at the end, time for whatever questions you have. We've got a little quiz with some prizes, and there's also a form to fill in if you'd like the notes. So if you haven't filled that in, grab it off that chair, just put your email address down so we can send that to you. So, not sure if you've heard who GLA Farmer are. I can get this thing to work. Might need your help, Kim. Oh no, there we go. Just need to push it properly. so that's us there. So that's we're just a small team. That's on our Christmas trip to Waihingi Island. So there's just the 3 of us: myself, Kim, and Danielle, our marketing person. The reason we exist basically is that I worked in the UK for 7 years as a predominantly a small animal vet. Realised coming back to New Zealand quite frequently that the dearth of products that we had here, we really lacked a whole bunch of things. I think at the time, this is mid-2000s, there were 3,000 registered products in the UK and 1,000 in New Zealand. So I saw an opportunity and thought, well, this can't be right. Cats and dogs are the same in New Zealand as they are in the UK. They need these products. So that's what we aim to do. We aim to bring unique and novel products into the country for the betterment of you guys, the pets and the animal owners to improve the quality of life of everyone. So we've been going about 2.5 years. We started off with the derm care range. We're now just expanding. This is some of our products. We've actually got more since that picture was taken, but yeah, expanding all the time. So that's us. We'll talk a bit more, like I said, about our new dental range in a minute. But now I'd just like to introduce Janine. Cool, that's working. So Janine graduated in 1997, similar vintage to myself. Worked as a general vet for a long time, both in the UK, Australia and back here in New Zealand. She gained her membership with the Australian New Zealand College in 2016 and has since been building up her referral dentistry practice. And she was just telling me she's done a lot of educating of certain clinics around the country, which is a really good help, in terms of educating vet staff, not just vets but also vet nurses and receptionists. One of her aims is to educate pet owners to improve the quality of dental health and also to educate clinic staff. So, yeah. Thank you, Janine.
Hi everyone. Hello, most of you. Thanks for the introduction, Peter. We haven't got a clicker, so...
I'm the clicker, hi.
Once again, the clicker. So this is kind of a part of a presentation that I've actually been going on, as Peter said, into different clinics, speaking to vets, nurses and receptionists. So this is just a bit of that. Slide, please. So today we're just going to concentrate on a clinical exam and in the consult room. Then we'll just do an overview of periodontal disease. And then I thought I'd go through the 5 most common, or the 5 common referral cases that I'd see, being the base narrow deciduous canines and the adult canines, fractured teeth, gingival trauma in cats, where those premolars dig into the molar teeth, and then extraction of 309, 409. So to the next one. So why is oral health important? So up to 80% of dogs and cats over 3 years old have some form of periodontal disease, and 10 to 20% of dogs and cats also have fractured teeth. So if you look at those two statistics, you can see it's going to be a lot of animals that we're seeing have dental problems. And I'd say in the last, definitely since I got my memberships, probably a wee bit before that, there's been a big push to prophylactic dental disease as opposed to just treating them when they come in really bad ones. So oral disease and dental disease is painful, and it can obviously also cause systemic problems. When they're chewing, they get a bacteremia into their bloodstream, which can then cause damage to the heart, the liver, and the kidneys. And if we do get on top of it, some things are actually reversible, other things we can stop them getting worse. So if they have routinely, timely dental care and good home care, then that can really stop the disease progressing. So the key facts, it is painful and the animals can't speak. So we have to be advocates for the animals, really. Halitosis, which is bad breath, that's often the thing then owners start looking in the mouths because that's what they notice. It's caused by bacteria as well as necrotic tissue. And most pets will not outwardly show signs of dental disease until their mouth is really bad. So we need to be actively looking into the mouths. Sometimes the only thing you'll see is a behaviour change, and you only know it's a behaviour change because after you've done the dental, they say, oh, it's like a new dog, it's like a puppy again, it's playing with this toy, and you realise how much pain it's probably been in for quite a long period of time. So the oral examination is really important, and this is when they come in with a dental problem, but also at vaccinations. And even if they come in for any issue, you can always look in their mouths. But you want to make sure you've got good lighting, you're using your eyes, lifting the lips is really important, and I've got some slides about that coming up. Note the pain and the smell. Sometimes we get the owners to hold the animal, and then that means they often can't see in the mouth. So in that case, it's good to either take a photo or get a nurse or someone else in to hold the animal, so then the owner can actually see what's going on. So pushing up between the mandibles, you're going to get a good view of under the tongue, where you might get squamous cell carcinomas, but also sometimes trauma from that molar tooth, if there's a lot of periodontal disease around there. And obviously that cat's got some kind of tumour going on in the back of its mouth. So lifting the lip is really important, and you can see in that first photo, we've lifted the lip, but even like lifting the lip like that, you can only actually see back to the left side, so that's 208. So you want to lift the lip right back so you can see to the molar teeth. Really important to look at the incisors. Normally if you do that front on, lifting the lips there, and then open the mouth fully to see what's going on in the palate. This dog here on your left, it's got deciduous teeth and permanent teeth. It's also got this very odd canine tooth that's just not developed, has weird enamel on it, so that one had to be extracted. Just remember in the cat, the frenulum of the cat comes up over 207, 307, and that first premolar tooth. So it is quite easy to look at a cat's mouth and think, oh yeah, that doesn't look too bad. But if you pull that frenulum down, and this is the same cat and that's its x-ray. So you can see the frenulum is covering that tooth. You pull it down, the gingivas or hyperemic and edematous here. And then this is the x-ray with the resorbing roots. So it's grade 2. You can do a crown reduction. Take the crown off that one. So it's just important to pull the frenulum down. And this is just another good example of how easy it is to miss teeth. This dog here, really nice gums, there's very little plaque, very little tartar. It even has all its incisors. This dog was one of Geraldine's cases that came in with epistaxis, so bleeding from its nose. If you just go to the next slide, it's actually a little black dot here. Because it's fractured, and it's fractured kind of on the distal surface, and that's its x-ray. So, very easy to miss if you're not doing a proper exam. I mean, you probably would pick it up doing if you had X-ray machine, but obviously if you did it, you could just think, oh yeah, its teeth are all fine. So that's a good example of, make sure you look in the mouth. And I just forgot to mention on the other slide, just at the bottom here, if you're seeing an animal and it could have a fractured tooth or some trauma, if you could write that in the notes, because some insurance companies, and I had this recently, weren't going to pay out because the initial vet hadn't said it could be trauma. So if in doubt, it's always a differential. If it's an aggressive animal and you can't look in the mouth, which is what had happened in this case, just write differential, could be a trauma case.
Janine, which insurance companies cover teeth?
Well, it depends on the policy, but some of them will be covered under surgical if it's an accident, trauma.
There's lots of them trying to wiggle their way out.
They do, and I often write letters, take photos and send them in, because it really annoys me when insurance companies don't pay out for something they have said that they will pay out for. Yeah. So safety first. I think we don't want to put ourselves into a position where we could get bitten. So if the animal is looking aggressive, we get the owner to pull the lips up, and if they can't, or if it's still growling, then I think we can just say we need to have an anesthetic. And then you can do a proper examination anyway. So obviously you can't muzzle an animal if you're looking at its mouth. So signs of dental disease, I'll whip through these because I know you guys know them, but halitosis, blood or purulent discharge, dropping things, preference to eat on one side of the mouth, and in that case the sore side will have the build-up of plaque and tartar, so I'm chewing on that side. Preference for soft food, drooling, difficulty swallowing, teeth chattering, rubbing the mouth sometimes along the carpet, behaviour changes, and swelling on the face, like this premolar 4 is fractured, an abscess appearing on the face there. So if you do see such a case, you're doing a dental, the steps for the dental profile treatment, you're getting them in under the anaesthetic, oral examination with probing, and it's really important that you do probe and look at the x-rays together, because it takes 40% mineral loss before it will show up on an x-ray. So if you're probing something and it's got a deep pocket and you x-ray it and it looks normal, you have to go with your probing, really. So that's why it's so important to probe and to x-ray and to look at it all together. You don't look at them separately. You always want to use a dental chart. Remove the calculus first before you take x-rays, just because it shows up on the x-rays. Then you do your extractions, polish, flush, and then your home care, which is a very important part of it. So the owner has to know that just because they've had one dental, that's not it. That's something that they're going to be having to keep on top of with home care or coming back to the clinic. So probing and charting, remove the gross calculus first with the forceps. The periodontal probe is used to measure the sulcus depth, less than 3 millimetres in a dog, less than 1 millimetre in a cat is normal. However, if you've got a Great Dane versus a Chihuahua, there's got to be a little bit of a grey area there. And what I would record is I don't record everything. If it's normal, I don't write it down, because then my chart, for me, looks messy. So, but what you would want to record is the probing depth, gingivitis, if there's a big build-up of calculus, mobility, and if there's any gingival bleeding. So the periodontal probe is that end, obviously that's what you use for the gingival sulcus. This other end, the sickle shape, is good for feeling around the cemento enamel junction, if there's any tooth resorptive lesions. Also, if you have a possible pulp exposure, you can try to stick that into the black spot to see if it goes in. I don't have a fixed chart. I'm quite happy to use the charts that the clinic has. I like the ones with the numbers on them, and I always send the animal home at discharge with a chart, because often they've spent a lot in dentistry and surgery, and if they can't look in the animal's mouth, they don't know what's been done. So it's good to do a nice clean chart with no blood on it and send them So you want to consider all the abnormalities. If you are doing any staging, make sure that whoever's writing the chart doesn't do the chart, take the x-rays, and then kind of not put the two together. So you want to if the nurse takes the x-rays, you still need the vet to look at them and look at the chart and combine the two. Look at the individual teeth versus the whole dentition. If there's enamel hyperplasia on one tooth, that's different to if it's on every tooth in the mouth. It could be a trauma thing if it's on one tooth. It could be a fever or a drug problem, something that's happened if it's on all the teeth. You need to think of the temperament, breed, and the age of the animal. Sometimes, for example, if you had an older dog with resorbing roots, it's not painful, it's below the gum. If it's a Labrador and it's 15, they're probably going to last it the rest of its life. I wouldn't go in there causing any more trauma if I didn't have to. But if it's a 3-year-old animal, then that's quite different. And this is just a good example of radiographing teeth and why it's important. So that first photo, young animal, really clean teeth, no gingivitis, no plaque, no tartar, hadn't been marked that canine's missing until someone noticed and x-rayed it, and obviously you can see it here. So I'm not exactly sure what happened to there, but you want to extract those teeth because they can form dentigerous cysts if they're unerupted. And a dentigerous cyst is when the tooth erupts, there's a lining over the crown, so it wears off as it erupts into the mouth. If it doesn't erupt, the lining stays on the crown and you get a build-up of fluid between the crown and the lining in about a third of cases. Not everyone. So if they want to monitor, you could do that. But if it's 305, 405, that first premolar down the bottom, and you want to make sure you haven't fractured the jaw if you've taken out a canine tooth, but you want to x-ray after every extraction, and specifically to see if you think you've fractured a tooth root, like this one here, you definitely want to be writing that in your notes. We're not perfect, that happens, it happens to human dentists too. The only problem is if you don't write it down. So you need to write it down. If that did happen, I'd put a needle in and x-ray it to see where it is relative to my needle. And if it's just underneath, the easiest time to get rid of it is right then. And you just take off the bone on the lateral side, just gently, and then often it will be right there. You can just pop it out. So just a bit about periodontal disease. 85% of dogs and cats older than 4 years, and some pets are very young when they have it. So it depends on the breed. Small breeds, overcrowded mouths, they often have retained teeth, they often have malocclusions. Their diet often, because of the owners of small breed animals, often they'll be getting human food or something, so their diet's not as good. And they might have hairy faces, which also the hair gets caught all around the teeth as well. So it's not the same for every animal. A Maltese is going to have much worse periodontal disease earlier on than a dog. And when we talk about periodontal disease, it's the inflammation of the 4 tissues that support the teeth, being the gingiva, the cementum, which covers the root surface, the periodontal ligament, which goes between the tooth and the alveolar bone. So we've been through this, common signs: swelling, plaque and calculus deposits, gums that bleed easily, gingival recession, furcation exposure, and discharge. And the take-home message, I think, about periodontal disease is periodontal disease stage 1 is gingivitis, and it's reversible. Once you get past that into stage 2, then it's no longer reversible. You can treat it and get it not to get worse, but you can't make bone form that's been lost. So I will whip through this pathogenesis. Plaque is a biofilm of salivary glycoproteins and ingested polysaccharides that forms on the teeth. Basically, as soon as you've done your dental, the plaque's going to start forming again. And it's the bacteria in the plaque that when it's above the gum, it's gram-positive. And then as it gets worse, gets below the gum, and it becomes gram-negative. And so once that plaque gets below the gum, then the host responds, and it's the inflammatory mediators from the host that go on to cause the bone loss and the gingival recession and the periodontal disease. So the calcified plaque, that's raw calculus, but it's actually the plaque getting into the gingival sulcus that's causing periodontitis. So in a flow chart, you have a biofilm forms within minutes of descaling, gram-positive when it's above the gum, gram-negative when it gets anaerobic below the gum. You have inflammatory mediators released, and then your connective tissue gets destroyed. And then the host response to that is to release more inflammatory mediators, which then destroys more of the tissue. It doesn't happen in a linear way, it waxes and wanes, and eventually the tooth will come out. So plaque biofilm forms on the teeth, attracted to rough surfaces, and the tartar is your hardened plaque with mostly dead bacteria, which is mineralised by what's in the saliva. And just remember that it's not only what you see in the mouth that it's painful for the animal, but it's also the systemic effects of this periodontal disease, which is why it's so important. So in a consult, you can't actually tell what grade periodontal disease there is because you need to probe it and you need to x-ray the animal. So all you can really do is give a dental score, which every clinic will be different, but maybe a 1, 2, 3 system, grade 1 being gingivitis, grade 2 being worse, grade 3 being worse, and you have to say to the owner, we won't know till it's under the anaesthetic exactly what's going on, which is why you want to give an estimate, sometimes making it quite broad rather than being specific. So stage 1, plaque, a little bit of tartar, slightly inflamed gums and gingivitis, but the probing depths are normal. You would want to do your x-rays, descale and polish, and that's reversible. So it's definitely worth treating it because it stops it getting worse and going into stage 2. So that's how you treat it with your cohat and your home care, descaling, x-ray charts and everything. We know that. Sometimes you can use, in some animals, Sanos is, and those smaller animals where the owner wants to do absolutely everything they can, then that is a time when I would use Sanos, which goes basically into the gingival sulcus after cleaning, and it hardens and it stops the plaque and bacteria getting into that gingival sulcus. So stage 2, less than 25% attachment loss. Stage 1, furcation, which furcation is between the roots, the multi-rooting tooth. So a third in is stage 1, 2/3 stage 2. If you can put your probe all the way through, that's stage 3, and that tooth should come out. If I just go back a second, you're trying to save the molars and the premolar fours. So if I was presenting with that case, I would be taking out 3 teeth because you've got some vertical bone loss there, and you've got a bit of furcation, especially. That tooth actually looks okay. So I think if you can sometimes take out the other one, you're going to get rid of that pocket, and so you're going to save them. Sometimes you can do enlarged flaps. You obviously want to do your descaling. Sometimes you can use your hand instruments to make sure you've got all the plaque and tartar off. Sometimes you can do periodontal flaps, which is when you do like a gingival flap, and then you descale where you can actually see, make sure you've got everything, and then you suture it back up again. You do have to be careful though, you want to pick the right animal and the right owner for that, because often I think it will just get worse. Stage 3, 25 to 50% attachment loss. Stage 2 to 3, furcation. So this cat has got furcation exposure there, even though those roots are looking good, you're wanting to take those teeth out, because basically, as soon as that animal wakes up, the plaque and tartar is going to form again in that furcation. And then stage 4, obviously, advanced periodontitis, more than 50%. Once you've got more than 50% attachment loss, basically you're going to take the tooth out. There's no going back from that. So extraction is the only realistic option, probably for many stage 3 and basically all stage 4. So dental home care is really important, because after you've done your descale and polish and your extractions, you want to stop that all happening too fast again. So the owner needs to be aware that they're going to have to come back and do some kind of follow-up. And toothbrushing is something that is the best thing to do. However, you've got to look at the owner and owner compliance. And although toothbrushing is the gold standard, if they're not going to do it, it's the worst thing to do. So you have to make sure that whatever you're telling them to do at home is something that they are actually going to do. And if they not going to do anything, they know they should come back in 12 months. So some factors to consider in home care. Only subgingival plaque and calculus will lead to periodontal disease. Removal of the calculus alone will not prevent periodontal disease. It will maybe help with the smell, and the owners will be happy because there's no tartar there, but for the periodontal disease, it's the plaque and the subgingival sulcus. So you can have passive home care. Chewing is done by the pet, like TD, for example, or a dental chew. Active home care is your toothbrushing or rinses applied by the owner. There's a lot of information and references about this, so I won't go into it in too much detail. But you have to make sure about the owner compliance, which is higher for passive. So sprinkling powder onto food, for example, or a water additive is something that's much easier to do than brushing the back teeth of a cat or an aggressive dog. They're just not going to do it. So mechanical, physically rubbing the teeth off. Chemical, you've got your mouthwash, your gels, your water additives. And I guess you have to find a product that suits that. MaxiGuard wipes, I do use them quite a bit because you have both the chemicals as well as the action of the physically removing plaque. Healthy mouth is no longer available, and Plaque-Tiff has expensive technology, right, which softens the calculus and makes it obviously easier to get it off the teeth. The Veterinary Oral Health Council website has many different products and what if they've got a seal of approval for plaque or for tartar or for both. So that's a good website to go to as well. So when to recommend a dental cohat? If there is mild pathology, you still should be recommending, certainly if you haven't done full mouth x-rays on that animal before, be really worth it to get them in just to see what's going on, so you've got a baseline of what's happening. Remember that gingivitis, like this top one here, it is reversible. If you leave that for a year, it's going to just get into bone loss and or periodontal disease. And client communication is very important. Using models, photos, diagrams, charts, all those things I think are really good. Keep good records. And the main thing to remember is that the reason you're doing this is because the animal can't talk and it's really painful, and the owners need to know that, because otherwise they will spend the money on a bed for the animal or on a groom when it's got terrible teeth, and that's really sore. So discuss the dentistry plan with owners at your puppy kitten vaccinations, and get the nurses on board, because that's they're big advocates, and it's a way that they can really be used in a dental practice. And this is, I don't know how many of you were at the Meg Irvine talk the other week, but one of her slides, so this is from her, how you communicate is really important, because you have your clinical outcome, your emotional outcome, and the financial outcome. And sometimes you could do a very good surgery and everything goes to plan, you'll hit your estimate, but if emotionally, the animal's been dragged out of the cage, or there's been a bad discharge, if they haven't got the notes or something like that, then that can make the whole thing not nearly as successful. So those three factors are important. And that picture came up on my Facebook feed, which just makes me laugh. So true. So there's lots of different home care references. The Veterinary Oral Health Council one is a really good one, Wasaba Global Dental Guidelines, evidence-based veterinary dentistry, and there's more. Fraser Hale has a really good website, which is, just go to the next one, toothvet.ca. And he has really clear, good communication handouts that you can give to clients for periodontal disease, but also for things like ball therapy and polypotomies and base narrow canals, things like that as well. So long as you print his handouts in full and give him the credit for it, he's going to be fine with that. So that's just a quick run through of periodontal disease. And then I thought I would just go on and talk about some common referrals and kind of how to treat them and what you can do in practice as well. So I'd say the most common one is the base narrow canines. So this is in the deciduous teeth, and you can see this hole there and on the outside. So those very sharp canines are sticking into the palate, and they will be painful. And often these little dogs will carry something in their mouth, like a soft toy, because when they carry something in their mouth, their jaw isn't closing properly, and so they're not in pain. So the jaws are normally normal alignment. Self-correction can sometimes occur because jaws aren't all growing at the same time. The maxilla and the mandible do grow at different times, but on the whole they won't correct. So if you do see this, what you should do is to stop the pain is to extract them. You can't recommend ball therapy for these deciduous teeth because you'll break them. They're not strong enough. But a lot of people, and rightly so, are worried because you have the permanent tooth spot there. So it's right underneath that deciduous canine tooth. So the way I get them out is usually a cut over on the lateral surface through the gum with the scalpel over that deciduous canine. I usually do them surgically. And then just remember, don't elevate on the lingual side, so towards the tongue. You want to do everything distal, so behind that deciduous canine, lateral, buccal, and mesial, which is in the front, but you don't want to go on the inside of it, because that's when, if you go down there, you've got that permanent tooth bud, and you can damage the enamel. So then the tooth will erupt with an enamel defect on it, which can be restored with composites and things, but it can also, if worst case scenario, it may not erupt if you were really rough. Otherwise, if the denting's exposed, bacteria can get in, and that tooth might be sensitive. So just so you're aware, Tony Kaifa, I'm sure lots of you know him, especially from Australia, he's doing some research on doing crown reductions and vital polypotomies in those deciduous teeth. I've done a few of them, and they have worked well. So his theory is that you take the crown off, stops the pain, and then the tooth will exfoliate normally. And when I've done it, it has. I guess my concern is that if it didn't, then you've done one surgery and then you've got another surgery to do because the tooth hasn't exfoliated. But if you did have an owner who was, really giving you a hard time about causing damage to those permanent canine teeth, or they're a breeder or they're going to show the animal or whatever, then that's definitely something that you could recommend, and then I guess it's up to them to make that decision. So you've taken those deciduous teeth out, and then you need to wait till the permanent teeth are coming through. And so depending on where those permanent teeth are coming through, you have different options. If it's really, really mild and they just need to move a little bit, sometimes you can just do a gingivectomy, so you can just take out a wedge out of the gum. Sometimes, and especially in the dogs where it's a grade 2 malocclusion, so a short mandible, but you've got the canine teeth erupting medial to the upper canine teeth, you can't do ball therapy because the upper canine tooth's in the way. So those ones need the crown reduction and right colpotomy, which is when you cut the crown off, take a bit of the pulp out, and then put a restoration on top of it. Which the main problem with that is if the dog is going to, chew on a rock, or get rocks, or chew on frisbees or something, and the restoration is damaged, then it can be bacteria. Crown extensions, incline pain. Worst case scenario, you can extract the tooth. We just go on to the next photo. So ball therapy, that's when you get a ball slightly wider than the canines, and the animal has to want to play with the ball. It's really important, obviously, so maybe need to smother it in peanut butter or Vegemite, or put it in a sock, or whatever that animal likes with the ball. And then that works if those teeth have a space to move into. And then they play with the ball. It works best, I think, if the animal's less than about 15 kilos. If they're too big, it doesn't seem to work as well. Vital colpotomy, you're taking the crown off. Crown extensions, you put composite actually on the crowns and you kind of guide them out so that they'll grow. As the tooth grows, they'll clear the gum. Often for the extensions, you need to also take out 1 or 2 incisor teeth to make enough room. And if you go to that next photo, you can see that first photo there, you're not going to get that canine tooth into the diastema between the lateral incisor and the, so that's 103 and 104, because there's just not enough space there. So you'd have to take out 103. Well, you might have to do other things, but you'll definitely need to take out 103. And then once it's got enough space, then you might be able to do that. You can see that other little dog there, it's got a retained deciduous canine tooth, and then that 103 is really causing problems there, so you need to take out that. And then in front of it, that 403, so the incisor in front of the canine, is also stopping it moving. So if you kind of are going to take the teeth out around that canine tooth, it's more chance that it's going to be able to move into the right place. So this was just a ball therapy case. So that first photo I took out the deciduous canines. Then you've got the next photo, you've got your permanent lower ones coming through. This was my friend's dog, and she didn't want those retained deciduous upper canines to come out, so I left them in. But they did eventually, they were very wiggly, and she did play with the ball with the dog, I think 20 minutes 4 times a day. And then you can see there, that last photo, it's cleared the gum. It's maybe a little tight, but it's okay. And then this...
one tooth more expendable than another?
Sorry, say again.
So you're sort of saying, oh, those incisors aren't as important, take them out and leave the canine. Is that simply because of jaw strength, or why?
Well, there's a lot of reasons. I guess jaw strength definitely being one. The lower canines keep the tongue in the mouth. They're also, when they're young like that, they've got a really wide pulp, very thin dentin. And so they would actually be quite fragile and quite hard to get out. Whereas the incisors, I don't know, unless the owners really wants to keep all their teeth, I don't think they'd even notice whether they had
Did you
6
know
or
there's
4.
little dogs there? Who's out the front?
Yeah.
Little lights, and you think, oh, should we have kept that?
Well, yeah, I mean, those little dogs. Anyway, you do have to check to the owner about what they want, yeah. But on the whole, if you want to save the canines, which is probably what most people would want to save, you've got to have a space to move into, otherwise whatever therapy you're doing is not going to work. So that was a case study for the extensions. You make them green because when you're taking the composite off, it's very hard to see where the composite finishes and the tooth starts, and you don't want to be wearing the enamel away. So you make the base layer green. So that's just a case study for that one. Fractures. So you need to know, is there pulp exposure? And how old is the animal? So the apex of the root, so the tip of the root, closes around 12 months of age. So before it's closed, you can't do a root canal. If they want to save the tooth, you can't do a root canal because there's no plug at the end. So that's why you always need to know the age that the animal is. A root canal can also be done at any time. So if the tooth was fractured 3 days ago or 3 years ago, you could still do a root canal on it. There's no time pressure. I don't think you need to give them antibiotics if you see a fractured tooth, because sometimes they won't be able to get into the clinic for 6 weeks, and you don't want to give them 6 weeks worth of antibiotics. So maybe pain relief if you think it's painful, but with all the antibiotic resistance, I don't see a need for that. So if it's a complicated crown fracture, the pulp's exposed. If it's an uncomplicated crown fracture, then the enamel and dentin are exposed, but not the pulp. Yeah, a lot of animals have crown fractures. Just go on to the next slide. So if you do have a young animal, less than 18 months old, and they've fractured the tooth, in the park or whatever, because the pulp is so large, you can sometimes do a vital pulpotomy on it, which is when you take out a bit of the pulp and you put a restoration on, and that way you can save the tooth. To be honest, in Christchurch, there's only Marcella and I doing these operations, and probably, one, the owner probably won't see it in time, and two, even if they do, we probably won't be able to put them in, but you could always try. We need more people doing the memberships or getting involved in doing restorative dentistry. So a tooth like this one, you could, if they wanted to save the tooth, you could save it because it's a chip fracture and the fracture doesn't extend below the gum line. But I've got a slab fracture, not quite yet, a photo coming up, and you can't do a root canal on those ones, they have to be extracted. So leaving a fractured tooth to be monitored is no longer appropriate. And this is just an example of young animals with a wide pulp. So 7 months old, this is open here. You were asking Nick about extracting them. See how wide the pulp is compared to the dentine? So it's a lot more fragile. And 12 months old, you've got the apex closed. Once it's closed, it's not going to erupt further into the mouth. Again, a very wide pulp. And it's actually a lot harder to do a root canal on a young animal because the pulp is so wide, it's really vascular, it takes ages to get it all out and do it properly. Whereas on an animal which is older, the dentine's really thick, the pulp's really thin, and it's a bit easier once you find it. And just in case you're wondering, this is the pulp wound, so that's in the recent fracture, that's what's in the tooth. So if you can get that out, that's quite cool, that means you can get it really clean. So you're taking all the pulp out of the root canal and you're filling it with gutta perca, which is a rubbery sterile substance. These slab fractures that they get from chewing on bones and antlers and hard things, So it extends under the gum, it's like a longitudinal fracture, you've got to extract those ones.
So do you talk to animates about antlers and how inappropriate?
No. Do you?
Yeah, well I talked to the owners about it.
Yeah, I talked to the owners. Yeah.
But it's a shame that products like that are still being
I
marketed actively.
know. And in humans, you go to New World and there's all these toothbrushes which are firm bristles, and you go to the dentist and they always tell you to use soft ones because it's bad for your teeth, and you think, well, why are they all there on the shop then? Yeah.
So do you think we ought to, as veterinarians, be talking to animates?
I don't know if there's anything you can do, is there? I mean, you could, maybe we could ask Seaton. I don't know if there's, we don't have anything, we can't tell them what to do, we can't sell, just educate the owner. Just a little bit about discoloured teeth, because a lot of the time people aren't sure, do they really have to take it out, it's had it for a long time, and it's not causing any pain, but we don't actually know that, because that's how the owner perceives it. So if this was a really recent thing, like it had just been whacked in the mouth with the ball or whatever, then it would definitely be worth trying it on anti-inflammatories for 2 to 3 weeks. Sometimes the colour, especially in a young animal, the pulp's wide, sometimes the inflammation will go down and you'll see the colour kind of go back to normal. You would still want to x-ray it about 6 months later. But the reason you want to take them out or do a root canal is because the pulp tissue degrades, the intercellular pulp contents leak through the apical delta and cause inflammation and periodontitis. So in all the ones I've done on this, where I've done a root canal, the pulp is dead. It's necrotic, it's black, sometimes it's a bit smelly. So I guess it's just like leaving a barley seed in, it's a nidus of infection just waiting to happen. So people don't like taking out mandibular molars in small animals, and I know why. But if you've got an X-ray machine and you've got all the right equipment, there's no reason why you can't. So you want to X-ray it. You can see in that photo, X-ray there, it's got hooked roots. So you just need to be aware, if you see those hooked roots, you just got to burr away more bone. I mean, you've got to get the tooth out, you've got to burr away more bone, that's just what it comes down to. So definitely X-ray it first. If they've got really bad periodontal disease, I would recommend you X-ray it before doing any type of descaling, because it might be it's already got a fracture. If the nurse or whoever goes in and descales and then you X-ray it and you see the fracture, how are you going to know if, I mean, there'll probably be a lot of bone or something. It's just much better to X-ray it first, ring the owner and say, we've X-rayed the dog, it's under anaesthetic, it's got a fracture, and then you go from there, rather than we've descaled the teeth and it's got a fracture.
And the plaque's holding it together.
Yes, the plaque's holding it together. Yeah. And you can see here, well, I don't know if you can see here, but there's a little fistula here, a little pink hole, because it's not actually that X-ray size.
So you're saying you take 2 lots of X-rays, one before you scale and one after?
Well, you could do that as well. I don't hold back on X-rays. The X-rays aren't expensive, so I definitely do one before. I mean, sometimes if I think
just in these little dogs.
Yeah, those little dogs, yeah. And if you can't get it out, usually in these teeth, it's because people haven't burred away enough bone. So sometimes the bones stick on the mandible compared to the maxilla. So you feel like you're burning away loads of bone. But then if you were to X-ray it, you've probably only burred 50%, and you can burr away a lot. You can burr away right down to that mandibular canal, because you've got all the bone on the middle side. So the main thing maybe that people might not do or might not want to do is just cut the crown. Cut a massive wedge out of the middle. Tony Kaifu recommends taking the whole crown off, just horizontally, gone. Because you're taking them out not from the top, you're taking them out with your wind elevator. So you want to get rid of any crown that is going to make getting your elevator into that periodontal ligament space difficult. So you can cut the whole thing. If you can't get it in the back here, cut that bit off. Then get a tape of Fisher burr, so like a 699, cut little troughs either side of the tooth, so that then you can get your winged elevator in, and you want to push it apically, kind of rotate it against longitudinally that way, and hold it. Because the periodontal ligament is used to chewing action, so if you do little movements, it's used to that, but it's not used to a big hold. So hold it for as long as you can. Let it fill with blood, and then it will come out much easier. Yeah, so radiograph before and after, especially in those small dogs. And I just put this one in, because I'm not sure if many people know, this is like a tooth within a tooth. It's a weird developmental defect. But quite often people send me x-rays, and they're just like, whoa, what is this? Because the tooth looks quite normal, the crown. So this is actually, that is the tooth. Can you see that? There? Yeah, so it's tooth within a tooth, and then you get enamel defects. So like this tooth here is actually quite pocketed. And so that was an incident, often the incidental findings, and then everyone's like, what do we do with that? If you Google it, you'll see loads of photos and x-rays, and they all look quite similar to that. And basically you can take the tooth out. Theoretically, you could do a root canal. I've never done that, I'm not sure it would work, but if they really wanted to try it, you could. And number 5, cats with lesions. Often it's Burmese cats or British Blues, those really wide-faced cats. So you get a gingival lesion next to the lower molar, 309 or 409. And people aren't quite sure what to do, So often what you need to do is get it in for the anaesthetic, take x-rays, see what's going on. You can extract teeth, but you can also just sand down the cusps of the upper premolar 4. So you can't take a lot off because there's not a lot of space between the enamel dentin and pulp, but you can certainly blunten it enough to make a difference, because I've done them before and you think, geez, I haven't removed much, but you descale the bottom, take the cusp off the top just a little bit, and it's enough to stop the trauma. So you don't actually, because a lot of people will think, oh, they've got to x-ray, got to extract the teeth, but often it will be a young animal, so that's quite a dramatic thing to do at a young age. It's really easy to sand down the cusps, to etch it and bond it and might cure it. It's not a hard thing to do at all. The only problem is that being in general practice, you don't have the equipment. So, I guess if you wanted to get the equipment. But sometimes, as always when you're talking to an owner, you're going to say, this is the plan, but when we get under the anaesthetic, it might be different. In this case, it was different. One of the sides had furcation exposure. The other side had a lot of bone loss around that mesial root. So, in fact, I rang the owner and said, these teeth actually, the molds need to come out, but I still sanded back the cusps because they were quite sharp and quite pointy. And that's it. Did anyone have questions? Were we over time or we?
No, no, good.
All right. Did anyone? No? Yeah.
If you're taking out both mandibular canines in these elderly frail dogs, do you stage it to procedures? Really popular, really disease?
Yeah, I wouldn't say I do. I don't have I do this for that. Like, I look at the animal, look at the X-rays, and then decide, I guess. So I don't have a plan necessarily beforehand of what I'm going to do. Yeah. I mean, you definitely before I'm extracting any canine tooth in those animals, you want to check the jaw. Because sometimes I'll have a really flexible mandibular symphysis. If you don't check it beforehand, and then you take a tooth out, and then you feel like you're like, geez, did I fracture it or something? So sometimes you can take them both out at the same time. But I guess I would take one out and see how that one went, and then decide if I was going to do the other one or not. I do have a bed tone, so I put that on a low setting, and I can pretty much get a lot of things out, but even then, if it looks really, there's not much bone and there's a lot of disease, those ones I might put on antibiotics before doing any surgery. Like, I don't use a lot of antibiotics, but I think they do in their place.
There's
Yeah.
a seeking stuff that you mentioned earlier, I've really forgotten it. I heard something.
Sanos.
Sanos. What's that?
It's a liquid that it has the VOHCL approved plaque, I think. A lot of specialists, there's a lot of grey as to whether people think it works or not. So even though it has the VOHC approval, people still are dubious. Yeah, so what you do is you need to clean the teeth, you need to make sure they're not bleeding though, because the fluid from the blood affects the setting of the liquid. So you maybe get a swab and kind of get someone else to hold the gingiva back. But you put it doesn't go on the crown, you put it into the sulcus. And it should go in there and then it sets. So you air dry once it's in there. And then you don't brush the teeth for a week, it's recommended, and it should last for 6 months. And it probably will cost the client something like $350, around that. So I would use it for those owners who want to do everything for their pet. And, I say to the owner, some people think this works, some people think it don't. So we could do it the first time and you can decide if you want to do it again. And a lot of them do come back to have it done again. But the theory is it goes in there, it sets, and it stops the bacteria.
And it gives them 6 months to perfect their brushing.
Yeah. For owners who can't brush the teeth, or the animal's aggressive, then do it. You get it from, VDS, I think is what this is. Do you guys know that?
No, but yeah, I think
Yeah.
Any other questions? Cool. Thank you very much.
That's
Janine.
okay.
That was awesome. I certainly learned a lot. It was interesting that I didn't understand that it was the inflammatory mediators that actually caused the destruction of the periodontal ligaments. Yeah, I just assumed it was the bacteria. Yeah. Cool. So I just want to have a quick chat about our new dental range. So it's called Plucktec Plus. It's made by Animal Care in the UK. Was launched there about 2 years ago and is certainly the market leader now in the UK, Germany and France, I think it is. It's vet exclusive, so you won't find it in the pet stores, and it is VOHC accepted for tartar. So how does it work? Basically it's got this patented exclusive technology that collates the minerals in the tartar, so it prevents the tartar, the minerals binding and causing calculus or tartar buildup. So it's the really cool thing about it, what I really liked about it when it was put to me, we were asked, do you want to take this product on, was the fact that it's actually clinically proven. I'm not sure, back in my day when I was in practice, there was a lot of stuff that was out there, but none of it actually was shown to clinically work. So as part of the VOHC approval, Animal Care had to go through quite a rigorous set of clinical trials. There's quite an immense protocol that they have to go through to do so. And what they discovered was that with the water additive, they found a 21% reduction in tartar or calculus buildup after 80 days of use. And you may think 21%, well, it doesn't seem like a lot, but with toothbrushing, which is considered the gold standard for tooth care, you only get a 37% reduction in tartar. So, and this is the water additive, so this wasn't the spray, the wipes, or the toothpaste. So just with the water additive alone, it's causing quite a significant reduction in that tartar. So yeah, pretty cool. The other good thing about the Plucktec range is there is a full range of products available. So we've got sprays, wipes, toothpaste, and the water additive. So you can tailor the products to the animal, to their specific needs. So for young puppies and kittens, obviously, you can start them with the spray and the wipes to help introduce them to dental care, and then add in the toothpaste and get them trained on the toothpaste. Of course, if they're struggling, the owners are struggling or just not interested in that, you can at least use the water additive. For the occasional toothbrushes, they want to do it, and there is a scale. I think it's done every week. You get a 10% reduction in tartar with toothbrushing. So by throwing in the water additive, you can also improve the oral health. Scale and polish candidates, obviously you can use the water additive to reduce the amount of calculus and soften the calculus pre-surgery. And then after the procedure, if brushing is not possible, which often it isn't because it's painful, water additive is a good alternative. And for those patients or owners that like the dental chews in food, obviously they're very good at getting the tartar and things off the molars and premolars, but it doesn't do anything to the canines or the incisors. So that's when you can use the spray or the wipes. So as I said, we've got a full range of products. So the water additive, which is the one that was VOHC approved, oral spray, dental wipes, and the toothpaste. So they all contain exactly the same thing. The reason why the water additive was the one that was that had the VOHC approval on it was that's the worst case scenario. So you would assume that if using it as a spray or wipe or a toothpaste, you can get a better result. We also have, as part of the animal care range, two other cool products. Orozyme, which you've probably heard of, it's been on the market for a long time. It's a general purpose toothpaste. We also have this OraStrip DX. I don't know, has anybody heard of the OraStrip DX or the thiol test strips? No. So it's been, I think it's coming out of the States actually, it's been there a while. As Janine mentioned, obviously periodontal disease is pretty common and prevalent in cats and dogs. 9 out of 10 adult dogs, 7 out of 10 adult cats have some degree of periodontitis, and of course it predisposes to a whole bunch of other diseases. And there was a study done recently that showed with any amount of periodontal disease there was an increased risk of chronic kidney disease development. And one of the problems is that visual awake examinations may not be enough to spot dental disease. So obviously the gold standard is anaesthetising them, radiographing them and visualising them. The next best step is to actually use one of these OraStrip DX strips. So that was shown to be much better at proving that the dog or cat had periodontal disease than visual awake examinations alone. So there's been a number of studies done, anywhere between 20 and 30% of patients that have a visual awake examination that appears normal will actually have some degree of periodontal disease. So it's often missed if you don't anaesthetise and do the gold standard. So that's where the OraStrip comes in. So they're just a little strip. You get in packs of 4 or packs of 50, and they're just simply like a Schumer tear test. The best place to do it is on the maxillary gingival surface. Poke it in there for 10 seconds, pull it out, and it's a clear colour change. It's a quantitative colour change. So the more thiol, the stronger the colour change. So really, really good for vet nurses and reception staff to show the client that you don't have to be involved. They can do it out in reception. Just quickly pop the strip in, and shows a very, very good and instant response.
So the strip changes colour?
Yep, the strip changes colour. So it goes like a dark yellow is the strongest. So
And that's showing what in the mouth?
Thiol concentrations are produced by the bacteria that are in there. So obviously that's I assume it's roughly a linear, the higher the number of the bacteria, the more the thiol is present, so the more likely it was, the more severe the periodontal disease. So that's Plucktec Plus. So we've in your goodie bags we've got the toothpaste to take home and try, either on your own pet or if someone in the clinic has a pet that you want to try it on. There's also brochures on both there's a detailer on Plucktec Plus and also a client. Now I'd just like to hand over to Kim, who's just going to quickly talk to you about the rest of our portfolio.
just a quick one before our fun quiz that we've got. So yeah, I just wanted to just go through what we can offer as a company to the clinic. So apart from I can come around and do any in-clinic training with the nurses and or vets, I've done quite a few in Auckland. I'm based in Auckland, and it's gone down really well. It is a benefit to the clinic to have the upskilling of dental products in the clinic and getting them testing and talking about it in the reception area before they come through to the vet. So we've got a vet detailer. We've also got the OurVets brochure and the test strips. We've got the dental order form, so we have, I don't know if we pop one of these into there yet, but we do have one of these dental order forms, which is quite good for, it's sort of set out as a prescriptive type thing that tool for the clinic, so you can just sort of suggest what products they could be using in clinic, whether it start off with a water additive or if it's a couple of kittens, start off with the oral spray or go straight on to the toothpaste if the owners are compliant with that. So that's quite a good form to use in the clinic. It is set out as a tear-off prescription type pad that you can get, so just let me know if you do need that. We do have shelf holders if it's something that you want to really promote through the clinic. And then as the full veterinary exclusive dental range, we've just set out a new dental display unit. So we were hoping to have one of these, but it didn't end up coming down to Christchurch. The box has gone missing. This is quite a cool little dental display unit that you can pop on the countertop as people walk in, or else if you just want to put it up on the shelf. We do have a special roadshow promotion at the moment, so it's basically just ordering one of each product, showcasing the clinic, and used to show the clients, and you will receive the dental display unit. That is available from SBS and Fortis at the moment, so both of those two wholesalers will be bring those in and be able to send those out as part of the roadshow special. Sorry. So just really briefly, as you can see, our range is growing over the last 18 months. We've got a really cool behaviour portfolio. So you may or may not have seen the Cilio product. A lot of vets have started ordering that and using it. We do have the dummy syringes that are quite good to show clients how to use that. It's a dexmedetomidine product, tasteless gel formulation, which is registered for noise anxiety in dogs. We do have quite a few clinics that have been using it for pre-clinic visits as well. Yeah, so any aggressive or anxious dogs coming into the clinic, we have been getting some really good feedback with that. A new product for us very recently is our generic range of pheromones. So we do have the calming collars for puppies and dogs. We've got the spot on, the spray, and spot on and spray for cats. We've also got a pheromone spray for rabbits as well. We will be getting, in addition to that range, being the diffusers a bit later on in the year, so we will have the complete range. It's very affordable for the clients, and they've got something for everybody. So it works within about 15 minutes, so very similar to the pretty much a generic range to what's on the market at the moment. So it works very quickly, and depending on whether they're just travelling and they just need it for a short time, or if it's cats that aren't getting on in the household, then the sprays are available too. I think we've popped a spray in the bags for you to try in the clinic. So yes, we're moving with the times. We've now got a YouTube channel. This has been really, really well received with clinic staff, nurses and vets. We've got Dr. Pete featuring, doing lots of training modules. So we've got dental, choosing the correct shampoo and why you choose it, Cilio training, so we will just keep adding to that. Just done a roadshow in Auckland on behaviour with Jess Beer, and we've added that to the YouTube channel as well, so do check it out. We've also now got a Facebook page and Instagram, so if you're wanting to keep up to date with any products that we're launching, any events like this, if you're wanting to